Hi, my name is Damian LaCroix, Superintendent for the Howard-Suamico School District. Thanks for watching these videos. The purpose of these videos is to make sure that you feel confident and informed about our return to school plans for the 2020-21 school year. So let's talk about flexibility. Why is it important for schools and families to be flexible as we transition among the plans, especially as COVID-19 shifts throughout the year?
Well, like I mentioned, flexibility is a great thing, and we don't have a whole lot of metrics. If you think about why isn't there not a whole lot of science around children in the disease, and people assume then it wasn't a pediatric disease, it's because what's the first thing every country did when they had an outbreak? We closed schools down. We kept our kids safe. This summer, we're starting to see its effect on the pediatric population, and we're learning more. We learned a lot more in the last 72 hours than we had in the last 72 days about kids and COVID-19. So the importance of flexibility needs to be there. The metrics that have been talked about around what's a good time to be, phasing out versus phasing in, is a statistic the World Health Organization uses, a percent of positivity, so number of positive people versus the total number of people tested, and having that consistently be less than 5% for a couple weeks, 14 days, because that's the incubation period of the virus. And they've used that to say this is when society is safe to reopen versus not reopen. And recently, actually the CDC director re-quoted that 5% as this is what defines a hotspot or not. It's important to remember everything that's in your plans are mitigations, how to prevent an outbreak. So those don't really happen, or they don't really work in the middle of an outbreak. That's like trying to fix the door on the barn after the horse is out.
Sure.
So you want that percent positivity under control for a good amount of time, and then the plans that the schools have, whatever they may be, and they're all very creative. And I think it's important to understand you can't compare school district to school district because everybody has different resources. But as you start to look at your school's plan or your district's plan, understand it has to have flexibility because there's going to be times where there's a pretty big outbreak, like today. Today we're in the middle of an outbreak where our plans may not work because they're meant to mitigate, not be in the middle of an outbreak. And there may be times where things get so good that percent positivity is consistently below 5%, say 3%, where maybe we could relax some of the things we've done and assess the breakout at that point.
Probably important for our viewers to know that we're in regular contact with each other, and we're sharing data to help inform kind of that gating criteria. Parents have asked, well, when can we expect, especially grades 5 through 12, to open the schools back up? And there's the guidelines that you referenced, and we're in constant touch with each other. We're talking with the Brown County Health Department as a partner, and you've been part of a larger coalition. Can you talk about the coalition over the last 2 months and the value from your standpoint that you've seen as school leaders have come together with medical health experts, Brown County Health, Greater Green Bay Chamber of Commerce? What's been your impression of that process?
It's what needed to happen. I think we somewhat set the stage as healthcare on, end of February, beginning of March. All 3 health systems in town met every morning at 7 a.m. and we've been completely transparent with each other. To this day, actually this morning, I get a text message from Dan Meyer and Chris Wesky, the CEO at Aurora Baycare and the CEO at Bellin, and we talk about how many positives we have in the hospital every single day. I'm glad to see that our level of cooperation has trickled down, and what the school superintendents were able to do with the Green Bay Community Chamber, as well as healthcare being at the table, and it's all about information sharing and collaboration. Bellin has different resources than Purveya has and Aurora has. We all have different resources. We have 2 hospitals, they each have 1. So there's different things in there. Every school district has different resources, and they're going to manage it differently. But the fact that they shared information, that they were transparent about their plans, and that they were okay with everybody having a different plan, I think it was a really good thing. But you're right, the amount of data sharing that happened was great, the information sharing. And it's all brought together by our public health officials. They really are the experts that we go to, as well as our science around the patient to make these decisions.
Have you ever seen this level of collaboration at the county level? You talked about the adults not necessarily being on the same page, but this is an example that should give us hope, I would think.
Yeah, it does, and I have more hope than I have disappointment. Especially in the last 4 months. I at one point was the president of the board for the Chamber of Commerce. So I know what it's like to try to get communities to collaborate. And we always haven't been the best about that. Even the sub-communities, Schwabanon, Alloway, it's the greater Green Bay area. And the level of collaboration I'm seeing now is unprecedented, very needed. It's adults being adults in the room, and it's very refreshing, actually. I wish all of the communities got to see how much work went into the plans that are being released. And everybody who's releasing a plan knows that it may not be the right plan, but it's a plan that they can be flexible with.
Yeah, I hope that gives our viewers a level of confidence to know that, at least in this case, the school district's not operating in a vacuum. We're not making these decisions independent of a lot of counsel, a lot of wisdom, a lot of advice being given to us by a number of stakeholders. So, and you've been a big part of that, so thank you.